Hello, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in New York State, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add to our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to offer sessions each for specific states so we can focus the content and share the most relevant with our attendees. I will just go through a few housekeeping items. We recommend viewing the webinar in Chrome, Firefox, or Safari, as you may experience some slowness in other browsers. If you are having issues with sound, try clicking the screen to allow the sound. And then if you experience any freezing or delays, try refreshing the page. And if that does not work, we would suggest trying to watch it in another browser. Everyone who registered for this event will receive a link 5 minutes after we conclude to watch the webinar on demand. Lastly, we will be holding questions till the end. If you have a question for our guest speaker, please use the questions tab to assure that we ask it at the end. To communicate with other attendees or to communicate any technical difficulties, please use the chat tab. We do have to stop today at 1 p.m. Eastern Time, so if there are any leftover questions at the end, Sarit has agreed to answer them afterwards and will email those out to the group. Now for our featured speaker. We are proud to introduce Sarit. Sarit is co-founder and co-owner of AllAcuServices, LLC, a company specializing in insurance billing services for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending nearly 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers and Mellon Bank, Sarit now applies her deep knowledge and understanding of the insurance industry to the field of insurance billing for holistic healthcare providers. Please join me in welcoming Sarit.
Thank you, Jeffrey. So as Jeffrey said, my name is Sarit Hirschkorn. I am the co-founder and co-owner of AllAcuServices. My partner, Robert Venna, is a licensed acupuncturist in the state of New York and in New Jersey. And what I want to do today is focus on telehealth and telemedicine. And I want to make sure that we are clear on the terminology. I also want to go through what is it that you can bill for, how long you can bill for telemedicine, what falls under telemedicine. And then we'll talk a little bit about pricing. We'll talk about HIPAA compliance, and then we'll talk about state lines. Can I meet somebody who is in New Jersey, but my license is in New York? So with that said, I'm going to get started, and we'll start with terminology. So, and Jeffrey, I'm trying to move the slides and just having a little bit of a hard time. Okay, thank you. So, let's talk about what is telehealth. So telehealth is the use of electronic communications by a provider to provide services for their patients. Things like doing an assessment, consultation, assessment of diagnosis, treatment, maybe educating your patient, management, care of management, and even self-management to the patient. And you as an acupuncturist, you may think, wait, how does it apply to me? I'm an acupuncturist, was so used to being with the patient in the room, being hands-on, taking the needles and really needling the patient. How is it that I can apply telehealth into my practice? So telehealth is the big umbrella of electronic use, and telemedicine falls under telehealth. It's the actual use of live stream video, faxes, telephone, emails, all fall under telemedicine. As an acupuncturist, when you look at telemedicine and the use of live stream video, we look at it as an evaluation. And it is an evaluation that's done with distance, but you do give your patient the same standard of care as if you were in the office. The patient has to be an existing patient, so it cannot fall under a new patient. It has to be a patient that is already under your care, where you've been treating them for either acute or chronic pain. Now, I'm going to talk about this next bullet because we're targeting today's session towards our New York provider. We know that our New York providers had to close their clinics. So if you are providing services via the phone and the patient needs to be seen by you within the next 24 hours, you cannot charge for telemedicine. You can only charge for acupuncture. This service, telemedicine, has to be initiated by your patient. So how does your patient get to initiate these services? Well, you can reach out to all your patients, send them an email, and ask about how they're doing. This is a really hard time for everyone. And by sending out an email to look to see how your patients are doing, the patients may reach back out to you and may want to have a session with you or even a discussion about their current condition or about what they're experiencing today, considering that many of us are home and it's really stressful. I'm going to go on to the next slide. Jeffrey, can we skip on to slide 5 and we're going to come back to the slide. I want to talk about New York and what does New York allows in terms of telemedicine. So New York is what we call a full parity state. Okay. New York in 2019 adopted telehealth. And when adopted telehealth, they adopted telehealth for Medicaid. Medicaid is a state-run insurance, and New York brought on the feature of allowing telehealth. What they specifically indicate that they do not allow as a state or will not allow state-run insurance companies is the use of email, phone, text, and fax, but they will allow the use of using a live stream video. Okay, we'll talk about what the specific insurance companies are allowing later on because we do have companies such as Aetna and Cigna, the Empire Plan, Oxford, Empire Blue Cross Blue Shield of New York. They are privately owned and they can amend and add on to what New York State offers. So we're going to go back and come back to this slide and we're going to go back to slide number 3. So Jeffrey, go back. Okay, so what falls under telemedicine? What can I do with my patient? So first of all, a discussion with your patient about their current condition. How are they feeling? You can see a tongue diagnosis. For stress management, you can offer things as meditation, Tai Chi, yoga, Qigong, discussion about the nutrition. I specifically know that while I've stayed at home for almost 3 weeks and I try social distancing, what I can't try is social distancing from my refrigerator. So if anybody wants to help me with nutrition, it would be, highly appreciated. But in all seriousness, things to boost your immune system. It's something that you can definitely offer your patients. Self-acupressure, I see many of our providers are calling their patients and they are sitting with the patients on a phone and really showing them points of where and how to perform self-acupressure. Hot and cold packs, so the use of hot and cold packs is something that you can do and show your patient as well. And I want to talk about ear seed. I had several of my providers create pamphlets for their patients. Along with the ear seeds, they charged for the ear seeds. They sent it to their patients, and they're spending the time with the patient, on putting those ear seeds on the phone. Okay, decision-making that you need to make with regard to your patients, a review of notes, all fall under telemedicine. Okay, let's move on to the next slide. Here are the codes for telemedicine. So we're all familiar with the acupuncture code of needling, a set of needling. So the first set of needling is 9810. Telemedicine works a little differently. It's very similar to what we look at with evaluation codes. Okay, the 3 codes in particular, and telemedicine divides these codes into 2 separate sets of codes. So one is for a phone evaluation, And the second set of code, which I would focus on specifically in New York, is digital evaluation via real live stream video. So we're looking at 3 different categories. We're looking at category of 5 to 10 minutes, 11 to 20 minutes, and 21 to 30 minutes. And at minimum, when you are performing these codes, you need to have at least 5 minutes. Now you're asking me, what are these numbers that are next to these codes and how do I charge for it? So it really depends on what you're charging for your first set of links. I can't tell you what to charge, but what I can tell you is how to come up with the formula of what you should be charging for these codes. So we know that acupuncture codes in the insurance world is worth 1.05. And if it doesn't mean anything to you, don't worry about it. Take your price that you currently charge for one set of needling. So let's say that is $100. In comparison to that, code 99421, which is 5 to 10 minutes of live stream video with your patient, you can charge 40%, so about $40, and I'm rounding it up, okay? Similar to that, code 99422, about 86%, so I would say $80, right? Relative to what you charge with your first set of needling, okay? And then, of course, 21 to 30 minutes. So if you spend more than 30 minutes with your patient, you can still only charge for that last code, the 99423, okay? And relatively to do the acupuncture code, right, you can charge a little more than $100, be $110 or $120 you can charge for that code. And again, so to come up with those prices, it's all relative to what you charge for your first set of needling. If you are completing your own HIPAA form of 1500 form and your biller is not completing it, your place of service is no longer 11. It has to be 02. 02 stands for telehealth. So make sure that you update your form to put 02 on that form. Also, modifiers. So many insurance companies do require modifiers. The modifier varies by insurance company. Most of you will put 95 as a modifier. Some insurance companies will tell you put modifier of GT. But again, you have to ask your insurance company if you're not sure. Tell them, I'm not sure if it's 95 or GT. For the most part, they will do what to use. Documentation. You still need to document those sessions just like you would document any other evaluation with the patient sitting in office. Either use electronic documentation or hard copy. Both are acceptable. Okay, let's move on to the next slide. And actually, before we move on to the next slide, let's move back because I want to mention one more thing. The time is cumulative. So these codes can be charged every 7 days once. Okay, so let's say I see Jeffrey today and I speak with Jeffrey for 5 minutes. And I schedule another session with Jeffrey on Monday for another 6 minutes. What you will be charging is for the 11 minutes because it's cumulative for the 7 days. So you'll add all minutes up that you met with your patient, whether it was 3 times a week or 2 times a week or maybe every day. You'll add it up and you'll charge only once for the accumulation of all the minutes spent with that patient. Okay, let's move on to the next slide. Okay, so I want to go back and just talk about, and I already mentioned that, the New York state law. So New York as a state allowed telemedicine since 2019. And what they allowed as part of telemedicine is just live stream video. What they didn't allow is emails, phones, text, or faxes. However, as I said before, many insurance companies adopted even the use of phones, specifically during COVID-19 pandemic. I'm looking here at Cigna, at Aetna, and you can see Aetna brought on the addition of even waiving your copay, your co-insurance, your deductibles as of March 6th, okay? However, plans like the Empire Plan, we know that the Empire Plan is a state-run insurance. It's specifically targeted towards our firefighters and our police officers. As you can see, they do not allow the use of phone. They are not waiving. They're not waiving the use of. They're not waiving the copay. Sorry, the deductibles and the co-insurance for out-of-network providers. They wanna, while they wanna allow in-network provider to waive the copays and the co-insurance and the deductibles, they still want to keep the costs low, so they're not allowing to be waived for out-of-network providers. Okay. Companies such as Axford are not allowing at all, not video stream and not phone calls, where Blue Cross Blue Shield will allow and will waive the copays, the co-insurance, and the deductibles. And further, they're willing to waive the timely filing restrictions. Now, for those of you who don't know what timely filing is we all have a specific time within our state or within our plan where we are allowed to submit a claim. So, for example, Blue Cross Blue Shield allows you today to submit an acupuncture claim within 120 days from the actual date of service. This 120 days was waived if you are performing telemedicine. Now, we're looking at the charts and you say, wow, that's great. Okay, let me just have the charts and I'm going to follow these guidelines. Well, it's not so black and white. Because there are many, many, many plans that fall under Aetna and Cigna and United, and these plans can be customized, especially if those plans are fully insured. Okay, those plans that are self-insured by companies such as Amazon that get their employees insurance. They can dictate their own rules. So let me just make sure that we're clear on what a fully insured plan is. So fully insured plan is, self-insured plan, plan is Amazon mandates the rules. They buy specific insurance and they hire companies like Aetna or Cigna to just administer those particular plans. For that plan, for an actual claim to get paid, Amazon or the HR on the Amazon side has to approve which claim gets paid and which one doesn't. When they do approve it, they then release the funds to companies such as Aetna or Cigna, whoever they hired, and the claim gets paid. They can come up with their own rules. And they don't have to allow not telemedicine, not telehealth, because they make their own rules. Okay, so the best suggestion I would have for you is that if you do have patients that are interested in telemedicine, call and verify coverage. That's number one. Find out the rep that you are talking to, their name, take a call reference numbers. You have to remember that all these calls are all recorded. And in the event that the claim does not get paid, have the rep have the service center pull up the call. They can pull them up and your claim will get paid. Also, you have to remember that this is evolving every day. We're learning new things. The reps who are sitting on the other side of the phone may tell you today that it's not covered. If you call tomorrow, it is covered. They're learning also as we go along. Okay, so just be patient with them. If you're not getting the answer that you want to hear or you don't understand what they're telling you, just ask to speak to a supervisor. And most important is documentation. So document who you spoke to, the call reference numbers, the rep's name. Also keep in mind that if the plan excludes acupuncture, so they're not allowing acupuncturists to perform acupuncture services, for the most part, they will not allow you to perform telemedicine. Okay, so plans that do allow probably will allow you to also perform telemedicine, but if they don't allow acupuncture for that specific plan, they will not allow telemedicine. Now, one of the questions is, hey, I'm sitting here in New York and I have a New York license, but Jeffrey is sitting in Boston. Am I allowed to treat that patient? So for the most part, and what you'll see in most states is the patient, you need to be licensed in the state that the patient resides and in the state that you are practicing. However, specifically for New York, and I'm only talking about New York providers, New York waived those state laws. So they will allow you to practice. If I decided to be in Florida or he's in Boston and I'm in New York, I am allowed to provide telemedicine services. I want to touch a little bit about HIPAA. You need to make sure that you are using a HIPAA compliant system. So systems such as Skype or systems such as Zoom are not HIPAA compliant. Zoom does have an application that is HIPAA compliant, which is Zoom for Business. And if you do have an EHR system, many of the EHR systems do offer systems that are HIPAA compliant. And while the HIPAA compliancy rules are in many states are very lax at this point, you also have to think of your patients and just compromised, not to be able to compromise patients' data. I know that if I would be a patient and I called my provider, I want to make sure that their system is HIPAA compliant and my data is not compromised. What I did actually in the next slide, Jeffrey, if you can go to the next slide, there are some systems that are offering some either free trials for 30 days or just offering, if you have less than certain sessions, they are offering HIPAA compliant sessions, and you can use those systems to do live video streams with your patient. I hope I covered all your questions. I think we can open it now for questions, Jeffrey. Thank you. Jeffrey?
Hello. Can you hear me okay?
Oh, yeah, I can hear you now.
Perfect. Thank you so much for that information. I'm also going to throw, while we're talking, I'm going to throw those links to these different telemedicine platforms in the chat for you guys. Also, Unified Practice, who's going to be a demo for us tomorrow of their new telehealth platform. They're a pretty popular EHR platform currently, and they've added a platform for telemedicine. And also, Jane App is the same. So let's go into some questions because we have a bunch that people have asked here. So just bear with me. I'm curious to hear about necessary forms needed for telemedicine and how it differs from our in-office forms. Also, is there an online platform for digitally signing these forms? Thank you.
So I'm going to answer these questions to the best of my ability. Some of these questions I'm going to have to research. So Jeffrey, if we can take those questions to later, I will write them down. But with regard to the current question, yes, you definitely make sure that you have consent forms with your patient. Your patient needs to sign a consent that they are going to have a telemedicine session. What I did see that there are some forms that talk about, and I'm not an attorney, so talk about if your video streams is compromised to make sure you are covered. I would reach out to my attorney. Again, there are definitely forms that need to be signed by my patient.
All right. And then next question. So if the patient lives in New York during this COVID-19 crisis, the patient now stays on the West Coast due to work or visiting family, can the New State licensed acupuncturist still treat that patient? Absolutely, because New York waived these laws and you can treat your patients even if they are in California, wherever they are. They have to be US though. They cannot be in England or Germany or Israel. They have to be in the US. But yes, okay. It is waived. But that's only for New York and then maybe select other states? We'll talk about the different states. Yep, different states have different laws, but because the focus today is New York, we'll keep it New York. Perfect. Yeah. And then the next question was, if the patient's from New Jersey and is now visiting family in New York, can the New York State licensed acupuncturist treat that patient? Yes. Yes, you have license in New York? Absolutely. So if they're in New York, you could. Yes. All right. And then does the patient have to have acupuncture benefits in order for the acupuncturist to bill the insurance companies for telehealth services, even if these CP codes are not acupuncture codes? Yes. So what we are seeing, right, and again, I would suggest that you verify your patient's coverage. What we are seeing for 95% of the patients that we verify that they do not cover telehealth medicine if the patient does not have acupuncture coverage. I would suggest, I never want to say never or no. So I would suggest you call the insurance company. But for the most part, they do have to have acupuncture coverage. Okay. Next question. A lot of insurance companies now waive the co-pays, co-insurance, et cetera, for the patients. What does this mean? And what if the insurance companies deny the payment?
So if they deny the payment, of course, right, that has to be part of you have to charge the patient. Patient is still, right, insurance company is never a guarantee of payment, right? Even if let's forget about telemedicine for a second, right? We're looking at acupuncture. The first thing that you hear on the phone when you call these insurance companies is there is no guarantee of payment. So while we will give you the benefits, the patient is still responsible for the payment of the session. The same with acupuncture. That's why they've signed a financial agreement. So if the insurance doesn't pay you, the patient has to pay you.
Okay. Last night, we were on another conference call with ASA and NCC AOM. There was a person going over telehealth insurance billing, and then they were told, or they said certain insurance companies are indicating that use of 99212, 99213 with other modifiers. Do you have any information on that?
So we're not hearing that. I'm not sure that you can use 99213, especially if you're not in the office. The insurance companies that we have called here specifically for New York City are allowing the telehealth medicine. I will look more into it and I will get Jeffrey an answer. So it's something that we're going to communicate back, but it's something I'm going to need to do a little research on.
Okay, perfect. Next question. Do you have any info about Oscar, which is another popular plan in New York?
So I don't have any information about Oscar. I will add that down to the list of research with regard to Oscar, and we'll get back to you.
Perfect. And then another one, a similar question. So another popular upstate plans are CDPHP and MVP. Any coverage for those?
Yes, so they do have coverage, but once again, it does depend on the patient's plan, right? There's so many plans that fall under these big umbrella insurance companies that you will need to verify coverage, but we are seeing that some of them do cover telemed.
Okay. Question, this may not relate to today's topic. Do you know anything about the current insurance policy in New York City regarding house call or house visit insurance policies?
Join my services. No, I'm just kidding. Yeah, definitely. Insurance companies do allow you to have calls. It does. This is something that we do as part of our verification. So us as a billing company, part of the verification that we do is the patient allowed to be seen in office setting or have house calls? Some insurance companies allow it and some don't. It does depend on the patient's plan.
Okay. When you combine minutes in a week, what date of service do you use?
The first day. The first day that you talk tonight. Mm-hmm.
Perfect. And then Elizabeth would like you to repeat how the use of minutes goes in relation to the acupuncture regular codes.
So sure. Can we go back to that slide?
Of course. And
okay. So, all right. So 97810, whatever price you charge, right? And I'm going to say $100, right? You can see that it has numbers, relative values. The insurance company refers to them as relative values right next to the code, okay? If you take 43% of what you charge for the first needling set, that's how you come up with the price. So I hope I'm clear, right? If you charge $100, and I always like to just round it up, right? If I charge $100 for the first needling set, I can charge, right, $40 for the first, for the 5 to 10 minutes video session, right? $80 for 11 to 20 minutes, and then maybe like $110 or $120 for 21 minutes or over.
Right. And if anyone didn't understand that, just throw that in the questions again, and we'll try to explain it a different way. Next question from Bettina is, I'm a little unclear. Can an LAC provide telemedicine in New York for clients that I usually see for acupuncture?
You could, again, but you need to make sure your patient is covered, that the plan covers the telemedicine codes, right? So the best thing to do is call that patient's insurance company, provide them the code. And when you do call, you need to ask, not only are you covering 99421, right? But is it covered by a licensed acupuncturist, right? Because some of these codes may be covered by another healthcare provider and not a licensed acupuncturist. So you do want to specify on the phone when you are calling, is it covered by a licensed acupuncturist?
Okay. Next question, does UHC cover telemedicine? Is a phone telemedicine session considered HIPAA compliant?
So they are, believe it or not, and I can put them, they are phone lines that are HIPAA compliant, that they go through some VPA connections that can be HIPAA compliant. But does UHC? Yes, there are UHC plans that cover telemedicine. Again, it's something that you're going to need to call and verify for each one of your patients who is interested.
Okay, and then what if people can't sign because they don't have a printer at home? Can they type in electronically signed by...
I wish I can give you advice because I'm not an attorney. I would say that you need it signed. Can they sign electronically? I'm not sure. It's more of a legal question.
Okay. And then next question, am I correct that we cannot take on a new client as a telemedicine client?
That is absolutely correct. That'd be an existing patient.
Okay. And the next question, didn't Cigna release a statement this week that rather than using telemedicine codes such as 99423, we should use regular E and M codes like 99213 and 99212? Again,
it's something that I'm gonna take a look at. And I think we said that before. I'm gonna take a look at these codes. And Jeffrey, I promise I'm gonna get back to you on these codes.
Perfect. I'll send these questions to you afterwards, and then we'll send off an email to the whole group as soon as we get the answers back.
We have a whole verification team in place. So when people do have these questions, or when we have the questions, we call the insurance companies and we'll find out. So
perfect. Well, thank you very much for that. Next question: if not using insurance, can New Yorkers treat new patients with telehealth?
Yeah. If you're not using your insurance and you want to treat your patients with telehealth, by all means.
Even a new patient, just as long as they're not billing insurance, if it's cash only?
Yeah.
Okay. All right. Do you have to verify telehealth coverage if they are already approved?
I'm sorry, what was the question?
Do you have to verify telehealth coverage if they're already approved for acupuncture sessions?
Yes. Absolutely. Absolutely. I would verify it for every one of my patients. Don't assume that just because they're covered for acupuncture, that the plan adopted telehealth medicine. So I would call for every one of my patients. You also want to make sure that you have a backup plan, and if they don't end up paying, that the call is recorded and you have that call reference number.
Okay. So more questions on the codes that were talked about last night. So we'll send that offline. Next one, can you also research information on Emblem Health, Oscar, and Health First plans for telehealth?
Yeah, Health First, we'll definitely check for them. And I'm almost positive that Health First will offer it. Health First, for those of you who are not aware, is actually a Medicaid plan in New York State. So I don't see why they wouldn't offer it, but we'll definitely look into this, and Emblem Health will look into this as well. Mm-hmm.
Perfect. And then have any of your clients been reimbursed already for telehealth sessions?
So here is what I would tell you. We've been billing for it. We're seeing all the claims as processing. Have they been paid yet? No, it does take some time. So our clients only started billing in the beginning of March. But we're following those claims closely to make sure that they will get paid.
And then somebody asked, did you say Skype is HIPAA compliant and Zoom is not unless you buy the business solution? Then are there any other free HIPAA online platforms like Skype?
Okay, so Skype is not HIPAA compliant. Zoom is not HIPAA compliant. Zoom for Business is HIPAA compliant. I know that Jane has a system, which is an EHR system that does offer video streams. But again, last slide, from what I found, these are some systems that offer free HIPAA compliant video stream.
Yeah, I've heard a lot about Doxy.me from some other practitioners, and they said, there's a really good free option. Unified Practice, if you're already using them for EHR, they have it. Jane, if you're using them for your EHR, they have. And then I've done a little research. There's another free EHR system called Charm that has a $20 per month upgrade to telehealth. So there are definitely a lot of options in the no cost and low cost area. Next question. So the insurance billing form has a billing date range option. If you are not using a bill range for the cumulative billing, when would you use the billing date range option?
When you're in a hospital?
Okay.
Yeah, if you're staying, right, these are, when you look at the range on the form, it has a start date and an end date. And the idea is really for patients that are staying and getting services for more than one day, right? When you stay in the hospital, it's definitely more than one day. It has a start and an end date of over a day.
Okay. Next person would like you to explain the code amount again for a total charge for the total time from 5 minutes to 45, for example. Are we adding the first $43 to the next amount?
No, absolutely not. So let's go back.
Okay.
Go back to the slide, okay? And, okay. These are 3 different categories, okay? You either spent time with the patient throughout the week. When you look at the total time spent with the patient, okay? Either up to 10 minutes, up to 20 minutes, or over 21 minutes, or right, up to 30, right? So it's not adding the pricing all together. You fall only into one of these categories, not into 3 of the categories, right? So if you spend over 40 minutes with your patient, you only fall into the 3rd category, okay? You're not, and that's the only pricing you're looking at is code 99423 or 99443, okay? It's not all these 3 codes added together, okay?
Perfect. And then would you do an example of how you would use the codes for a 60-minute telehealth session?
So I would only use one code, right? So let's say I saw Jeffrey today for 30 minutes and I spoke to Jeffrey again tomorrow. That's 60 minutes, right? I would only use, and we did a video, live stream video, we will use the 99423. That's it. They can only charge it once, right? And then I'll look at what I'm charging currently for my first set of needling. And you can see the ratio. And so if I'm charging 100, maybe would charge $120. I would put today's service, today's date on the claim.
All right. And then how does the patient sign and return the consent form?
You know, the patient, you need to send your patients the forms. The patients can print them out, scan them in, fax them to you, email them to you, mail them to you. Even sent to, you know, almost everyone that I know of has a phone. They can take a picture with their phone and send it to you.
Okay. Do you know if any of the EHR platforms, do they offer signed consent forms?
I'm sure they do. Yeah, I'm sure they do. So probably a good idea to look out for these forms on those EHR systems.
For telehealth billing, is it correct that we should the location box on HICF form blank when submitting these claims? This was advised at another webinar.
No, the place of service has to be 02.
Okay. So the place of service is 02, and that's the same as the location box?
Yeah, that's the location code is 02. Mm-hmm.
02. Okay. And then if you have previously not been using insurance with a patient, but it turns out their policy does cover telemedicine acupuncture, can you start using the insurance bridge since they are an existing patient in your practice, but not in the eyes of the insurance company?
Yes, it is an existing patient.
Okay. I understand that the telehealth service has to be provided to an existing patient. If the new patient is willing to do telehealth service by paying out of pocket for first visit, then the subsequent visit be billed on the insurance as an existing patient. Would this be valid?
No. No, it has to be an existing patient under your care. And the patient wasn't an existing patient prior to this COVID-19, or it has to be somebody that you've previously seen and not starting today. So the answer is no.
Okay. And then what are the options for new patients?
In terms of? I'm not clear what that question is. What are the options?
Sure.
You can still see them via telemedicine.
Just not
Charge
insurance.
the insurance, right?
Okay. And then do we have to send in documentation with the claims?
Absolutely not. So some insurance companies may ask you for documentation, but there's no reason to send the documentation upfront along with the claim. If they do ask you, insurance companies that don't want to pay will send you a letter and say, can you send us documentation so you can see how you use your services? And they can do it at any time. So make sure that you document. It should be, again, documented as if the patient was sitting in your office. So keep very clear documentation.
Okay. Does Health First cover acupuncture even though it is a Medicaid program?
Health First covers acupuncture. You have in-network with Health First in order to get paid by Health First. They only cover in-network providers, not out-of-network.
Okay. Is there a modifier to the 99421, 422, and 423 codes?
Yeah, it's the same modifier in the 95.
The
Yes.
95.
Mm-hmm.
Okay. When you send the transcript, would it be possible to write a couple of scenario examples of the payment with the billing codes the way you just explained it?
Yeah.
All right, I'll send you a detailed email with everything that we're going to need to follow up on. And then can you use DocuSign for patient consent forms?
Yes, probably. Yeah. I don't see why not.
Okay. And then do you know why you cannot take on and see new patients via telehealth?
I don't know. I can answer billing questions.
Yes. Do you have a telemedicine consent example or template that you could share?
I don't have one. It's something that you can either Google. Dr. Google is really good for it. Most of the time, it's really awesome for it. But it's something that you can probably take your current consent form and look what other people are doing out there on the internet and modify it. So, or reach out to your attorney if you have one.
Okay. And then the question about the location box on the HICF form was asked again because they think that we misunderstood it. So it's the place on the form where the location address is listed. And then they were advised last night in a seminar to not leave that completely blank or they wouldn't get paid.
Which location box? Is there a box number?
Sophie, do you have a box number that you can put into that or into the questions tab for us? I actually watched the same webinar that she watched last night, so I heard the same thing. She said that it's in like where you would list the location that the service was happening at, and that if you put anything in there at all, she said that the claims.
Your office location?
Yes.
So we haven't seen that. We'll tell you, definitely check that with the insurance company. Box 32, that's the office, the facility location. So we have not seen that, but I'm definitely going to do some research and let you know if that's something that impacts the claim or gets the claim denied. But I'm adding it to my notes to do some research on.
Thank you very much. So Sophie will follow up on that one a little bit down the road. We'll send an email to everybody with answers to these questions. Next question is, you had said that telemedicine has to be patient initiated. Can I send a MailChimp email to patients that I'm now offering telemedicine for acupuncture?
Absolutely.
You can, okay.
Absolutely, you should reach out to your patients and let them know that you're offering it. And by them reaching back out to you, that's considered patient initiation. So. And then
do you know if MailChimp would be considered HIPAA compliant? They wanted to know.
I'm not familiar with that system.
Okay. And then we already answered this one. Let's see. I'm not sure what is meant by the same as 95 in regards to the modifier for 99421, 22, and 23.
I am not. Can somebody explain?
It was about it was when we asked the questions about what the modifier for the 99421, 99422, and 23.
They also have a modifier of 95, right? So we talked about the codes 99421 through 99423 having a modifier. it's same use, right? So these codes, 99441, 99442, 99443, you also have to put a modifier of 95. However, in New York, I wouldn't suggest using a phone to reach out to your patient. It's better off if you're doing a live video.
Okay. Somebody just answered, it's box number 32 on the HICF form.
Yeah, that's the facility. I'm not sure that you need to take out the facility. Usually when you submit a claim to the insurance company, you have to put in the facility of which, where the services have taken place. And we haven't seen that we have to take out the facility, but we'll definitely look into it and get back to one.
Perfect, thank you. This is not a question, more of a FYI. I already sent in the chat window. Most of us have American Acupuncture Council liability insurance, and they have already sent out a telehealth consent form to their customers. So please check your email if you're an American Acupuncture Council customer. Alrighty, so let's see. Kim wants to know, just to clarify, in New York State, insurance coverage for telemedicine will not include phone calls at this time, only HIPAA compliant video. That is true. That's the New York State law. However, right, Aetna, Cigna, Blue Cross, those are privately owned insurance companies. They can add on to what the state allowed, right? I mean, if you look in general to what the state laws are for acupuncture in New York, right? It says insertions of needles, right? And application of pressure. It's a very, very vague scope of service. But yet, there's some insurance companies such as Aetna and Cigna that allow you to perform Twina and Gua Sha, etc., right? It's similar to that with telemedicine. Although the state tells you the minimum that you are allowed to do, those specific insurance companies that privately owned can add on to it. So we are seeing that Aetna does allow you to do phone calls, and so is Cigna. They just added on to the telehealth what else you're allowed to do. Okay, I went to the chat because we went through all of the questions. There's a couple questions that were placed in the chat. Can we use modifier 2225 for prolonged service, or codes 99354 to 25 for extend time over 30 minutes? So we haven't seen, we are not using these codes, so I'm not sure. We are using codes that we are billing with, which is 95. So I don't think so. But again, you need to check out with either your biller or their insurance company would be best. Right now, we just suggest to use 95. All right, and then last question, unless we get any others in the interim. Do you know if telemedicine for acupuncture will continue after June 30th? I don't know. It's something that they may adopt in the future, right? We see things evolving, so maybe in the future it's something that they will allow, but there's really no way of knowing. All righty, and then so at the very beginning, one more question. So can you explain what is the 95 modifier used for? It's to really indicate that this was telemedicine, right? So it is required on the claim in order for you to get paid. Similar to, right, today when you guys do an evaluation, we need to put in a modifier of 25, right? So if you're using the codes of 99203, 99202, 99201, those are evaluation codes. We use them with a modifier of 25. And usually the 25 is really to signify that it was a different service than the acupuncture, a different procedure. Although this is not used with acupuncture together, you do that 95 modifier. The insurance companies are requiring it for telemedicine. All right. Well, I think that might be it. Hold on. So somebody wants to clarify about telemedicine with LACs is only till June 30th. I mean, that was based on a question from somebody else who's attending this webinar where they asked about June 30th. Right now, at least from what Sarit's heard, she doesn't know anything about it getting extended longer than that. So I guess I have to wait and see what insurance companies do a little bit down the road. We are told right now that it is for 90 days, but again, right, every day that we call for another patient's verification, we're hearing new information. So things do change, and I would suggest that you call and find out if something changed for your patients. Okay. Actually, another question came in. If evaluation codes are not covered for acupuncturists by insurance plan, will telemedicine be covered?
Again, it depends on your patient's plan. We're seeing that a lot of the insurance companies are becoming very lax and all of a sudden very generous. So I would suggest that you call, though it may not allow evaluations, they will allow telemedicine.
Okay, and then do you use the same diagnosis codes? The same diagnosis codes when you see patients, or use the COVID one?
Well, you're not treating for COVID-19, right? We're not treating for COVID-19. We're treating for maybe your patient was suffering from back pain and you want to discuss that diagnosis with them. So you will be submitting on the claim the diagnosis that you're discussing with them. Maybe you are discussing stress with them. Their stress, whatever it is that you're discussing during the call, right? Whether it's to address previous diagnosis or current diagnosis, that's what you put on the claim.
All righty. Well, you have a hard stop time, and we have answered, looks like, every question that's come in. So I want to thank you very, very much for this informative webinar, and I want to thank all of our practitioners who joined us today and asked great questions and participated. We will get some research done on the questions that you guys asked, and we will send that back out to the group afterwards. Just please allow us some time, as Sarit is going to be doing webinars for us almost every day for different states to help give them some of this information. So again, stay tuned. We'll get some information out to you guys. I want to thank Sarit. Check out AllAcuServices.com. That's Sarit's website, and you can look into her services if you would like somebody to help you out with your billing needs.
Thank you, Jeffrey.
Thank you, and I'll see you tomorrow. And everyone, please tune in, as we'll have a lot more webinars coming your way.
Of course. Thank you.
All right, thanks, everyone.
Bye.
Bye-bye.